Hello, today I would like to share with you information how to recognize coronavirus infection, COVID-19, and why it is so important. Let's start with the information about the process of this viral infection. When the virus enters our body through our nose, throat, or eyes, it's the beginning of the phase called incubation. The incubation phase lasts about 7 days. For some people, it's longer. And during this phase, without any symptoms, the infected people they can already infect the others. After 7 days, after incubation phase, the disease starts. For majority of the people, for 80%, it is not severe. It is not a threat of life. It's just normal viral infection. But unfortunately, for 20% of the people, it's very severe infection. It is a threat for life. And for many of these people, it requires hospitalization. And unfortunately, in some cases, in few percent, it can lead to death. Uh, First early symptoms are fever and dry cough. For some people, after 7 days of fever and dry cough, there's another symptom which is shortness of breath. And for these people, unfortunately, it can very fast lead to the situation where they need hospitalization in intensive care units. So the process of infection is very fast. And because in many countries there are not so many diagnostic tests available, all of us, all the people, we really need to know how to recognize the symptoms of COVID-19 and how to contact, and because we need to contact medical doctors as fast as possible. So let's talk about symptoms. First of all, the most common symptom is fever. It's very early and it is for 90% of infected people. Then we have dry cough for 70% of people. It's also early symptom. Fatigue is only for 40%, so it's not so characteristic. The shortness of breath, it's let's say only for 20% of people, but usually it says that the infection is very severe. Sore throat, aches and pains, they are only for 15% of people. Shivering, which for example is very characteristic for flu, it's only for 11% of infected. But symptoms like diarrhea or nausea are very rare. It's only 5% of the people. But if these symptoms go together with shortness of breath, they can really say that the infection is very severe. Another quite characteristic symptom, very early symptoms, is the loss of smell and taste. It's very characteristic. It's for 30% of people, and we need to know that this symptom is really not so characteristic for the other respiratory tract infections. And symptoms like runny nose or sneezing, they are not characteristic for COVID-19. Now let's compare. On one side, symptoms of COVID-19. On the other side, symptoms of flu. Fever and dry cough, they are characteristic for two infections and we cannot distinguish. Fatigue, which is only sometimes symptoms of COVID-19, is very characteristic for flu patients. Usually flu patients, they really do not have energy. Shortness of breath is very rare for flu, but for 20% of COVID-19 patients, they can have these symptoms. Symptoms like pains and aches, they are not so common for COVID-19, but they are very characteristic for flu. So if the patient has many pains, aches all over the body, usually it's flu, not so much it's characteristic for COVID-19. Diarrhea is very rare during the process of COVID-19, but it's quite common for flu patients. And the symptoms like runny nose and sneezing, which can be quite common for flu, they are not characteristic at all for COVID-19. And we need also to remember all these symptoms of loss of taste and smell. They are characteristic for COVID-19, and they are really not a symptom of the other infections. We would like to inform you, and we would like to encourage you to get knowledge how to diagnose or how to recognize the symptoms of COVID-19, and how to contact the doctor as fast as possible, because the infection has very fast process, and we really need to be expert on that field to help ourselves or to help the other people. If you have questions, do not hesitate to ask. For those of you who wants to receive doctor's consultation, we can provide it via Skype or telephone. Let's be in touch.